This patient had a tight left ICA origin stenosis. As noticed here, there was a good ACOM collateral. There was near concentric calcific stenosis involving the left ICA origin. Beyond the stenosis, the ICA was angulated and had a tortuous course. In view of the near concentric calcific stenosis, we had planned to put in temporary pacemaker, as aggressive balloon dilatation can potentially result in bradycardia in these cases. In view of the tight stenosis, which was eccentric in nature, and near concentric calcification in the wall, we decided to cross the stenosis with a Traxus wire and do an initial 2 mm balloon angioplasty. This initial angioplasty was performed to allow smooth navigation of the filter. Thereafter, the wire of the embo shield was taken across the stenosis, parallel to the Traxus wire. Note the navigation of the wire of the filter across the stenosis. Once the filter wire is across, the Traxus is removed. Now, while navigating the filter across, the guiding had prolapsed back. The sheath was then navigated further closer to the stenosis to provide the necessary support to take the filter further up. Note that once the filter had been taken distally, the entire internal carotid artery had straightened up. The run taken post navigation of the filter showed kinking of the internal carotid artery due to the straightening of the vessel. Thereafter, a 3 mm balloon angioplasty was performed. Following the balloon plasty, we noted that the patient had predominantly paced beats. The exact stent was kept in place and a run taken showed significant impairment of forward flow and kinking of the vessel distal to the stent. Post stent deployment, we noted that the forward flow was significantly impaired. There was spasm and kinking of the vessel. The thought process at this point was to do a balloon plasty and give dilators to relieve the vasospasm. We also acknowledged the fact that the collateral was so good that the forward flow in this artery had significantly dropped. Post removal of the filter, the forward flow had improved. To avoid the kinking in the artery, one may have potentially considered using an open cell design which may have conformed to the artery contour.